Hi, I'm Dr. Anthea Rhodes, paediatrician here at the Royal Children's Hospital in Melbourne and your host for the Winter Wellness series of the Kids Health Info podcast. So with winter here, one of the things we start to see more of in our emergency department is gastro, and that can be a pretty grim experience for parents at home. There are ways that we can treat it, of course, and also ways that we can prevent it. And today, joining me to talk a bit more about this is Dr. Tom Glover, one of our specialists in the emergency department.
Great to be here.
From the Royal Children's Hospital Melbourne, this is the Kids Health Info podcast.
So as a parent myself, and as you are too, I know, gastro can be a pretty grim experience at home, and there'll be lots of parents keen to hear about what they can do to prevent it and, treat it as well when it's happening.
Yes.
Can you start by explaining to us what gastro actually is?
Gastro is a illness of the digestive system, basically often related to viruses, and it can lead to vomiting and diarrhea, which is loose poos, or some tummy pain as well. But it can be a combination of all of those or just one at a time. Often we'll have children present to the emergency department with vomiting, and then that can progress over the next few days to then developing some diarrhea. It's generally a very mild illness, and most of our children that present to our hospital or out in the community don't end up getting truly dehydrated, which is often a big concern of parents. They've seen their GP or they're worried about their hydration of their child, and most children do absolutely fine with gastro. It's just a really unpleasant experience, as you said. Both of my children have had it, and both of them are terrified of having it further, which means they're really good at washing their hands now, which is great.
Okay, so gastro or gastroenteritis, which is the full name of the condition, is an infection, and you mentioned it's caused by a number of different viruses.
Yes.
And really gets into the gut.
Mm-hmm.
One of the things you talked about there was hydration.
Yes.
So we do talk to parents about making sure their child doesn't get dehydrated.
Yes.
What do you mean by that?
It's a really good question. So parents often are very concerned about dehydration, but what does that mean at home and what does it mean in hospital? The first thing to say is it's very unlikely that a child will get acutely dehydrated from a gastro illness at home. It's very unusual for that actually to happen. Most children will take enough fluid in to be safe. The truly unwell dehydrated child you can often pick because they come in flat, they're very, very quiet, and they can often not be the normal selves. Now, most children with a gastro illness will not be like that all of the time. They might have a vomit and then be a bit flat and a bit pale, but then will pick back up again. The child that is truly dehydrated is unwell, and that's almost not any of the children we see in the emergency department, which is great. So true dehydration is actually very unusual. We don't want parents to be looking for signs of dehydration because they're what we call clinical signs, what doctors and nurses look for. But if your child is not drinking anything at all, is having ongoing vomiting with no intake and lots and lots and lots of diarrhea, not a couple of times a day, sort of 10, 15 times a day, that child may run the risk of getting dehydrated, and that is a child that should see a medical professional, either your GP or the emergency department.
Okay, great. And so it's that balance between fluid in and fluid out. And obviously you need to have enough fluid in to keep the hydration at a safe level.
Absolutely. And even if the fluid is only in for about 10 minutes or so, that child will still absorb some of that fluid, which is why the children at home often will vomit, perk up a little bit, have some fluid, and then 20 minutes, 30 minutes later, vomit again. That child is at less risk of getting truly dehydrated because they are still absorbing fluid. And we will often say to parents, your child is doing really, really well. They might have ongoing vomiting, but they're bright, they're happy, alert between those episodes. We can often try and help that vomiting in the emergency department with the medication, and that often breaks the vomiting cycle. But we just generally get a lot of these children home from the waiting room after a tablet and an icy pole in our department, and they often do really well.
Okay, so we'll talk a bit more about that in a minute. I just want to check what you mean by a couple of things you've described.
Yes.
So you said a child might appear flat.
Yes.
So that's something we talk about, as doctors and nurses. For a parent, what does that mean?
So a flat child will often be a child that is not their normal selves. Often a number of our children are very chatty, very interactive, very alert, maybe a much more quiet child, much more subdued. Subdued is a nice word for flat as well, or just lying on the sofa all of the time, not really getting up, not really interested in anything. Often not interested in screens, so parents will flag that as an unusual sign, but not doing their normal things, very quiet and minimal interest in things. That's what I would say was a flat child. Often that period of flatness can happen after a vomiting episode, and then the child will pick back up again. But if the child is persistently flat, persistently lying on the sofa, having to be sort of spoon-fed food or picked up and carried around, that is a more unwell child that should have a medical review.
Okay.
But the child that has a brief period of flatness after a vomit and then picks back up again, that's much more reassuring.
All right, so those are the things to look out for and might be that sign that you need to go to the doctor, or if you felt it was particularly severe, consider visiting the emergency department.
Yes.
And so you've mentioned then, once you arrive in the emergency department, if your child has a gastro illness, some of the things that might happen. Can you tell us a bit more about that?
The vomiting and the diarrhea are two separate things. Often the vomiting will start first and can last for sort of 24, 48 hours. And the diarrhea, which is the loose poos, can start after that time period, but can persist much longer. That can be sort of 7 to 10 days if you get a truly nasty bout of diarrhea. So diarrhea can come later and last longer. There's also no real treatment for the diarrhea in the emergency department. There is, however, treatment for vomiting, so we can give them a wafer. It's called ondansetron. Your GP can also give it to you and often breaks the vomiting cycle for up to 12 hours or so. And we may also provide a script to go home with. The other thing is to check that the child is getting some intake. We will offer them fluids. That might be in the form of an icy pole from the freezer, which goes very well with our children, or apple juice or water, or formula is fine as well. Whatever the child wants to take is generally fine by us.
And so if you're at home with a child and they're a bit up and down, as you've described, and they're having some vomiting, perhaps they've started with a bit of diarrhea, what would be the best approach to managing the fluids at home?
Little and often is the key. Often we find that they can't tolerate as big volumes, so a small amount of fluid, but more often, and keep offering it to the child. We'll often get them a big bottle just to sit with the child on the sofa and they can keep sipping out of that. We can be a little bit more generous with the child. Maybe their favourite drink or something like that would be more likely for them to take. So some watered down apple juice would be fine. The problem with water is it doesn't have any of your electrolytes in it at all, or your salts. So we would want something that had a little bit of flavour in it. But generally, we've come to the decision that whatever the child will take, they should have.
So the old kind of adage of flat lemonade, is that a yes or a no?
I think that's a yes from me, to be honest. There's some fields of thought that it's not as good, but I think it's great because it gives them sugar, which will perk their energy up. It'll give them fluid, so that's great. And it's just more likely to get fluid into them, and it will more likely to pick them up.
So, Tom, one of the things parents often wonder is whether there's anything they should avoid that might make the symptoms worse. And in particular, we hear about dairy products or milk. What's the advice there?
The advice there is it's unusual for that to make things worse. There may be a small group of children where it possibly makes the diarrhea worse. And if you find that, then please cease dairy. But most children will do absolutely fine. Most children really enjoy milk or milk-based products. And so you're more likely to get fluid into them if you're giving them their favourite sort of drinks. And so we would be very happy for you to try that. If it doesn't make anything worse, then that's great. Please continue it.
And related to that, parents often worry a lot about the fact that their child's not eating anything. So we've talked about hydration and keeping up fluids, which we know is important. What about advice around whether or not they're having any food?
When children have gastroenteritis, they often don't feel like eating. I've had gastro, my children have gastro, and you just live on a liquid diet for a few days, and that's totally safe. Children can be out without solid food for a number of days, as long as they are getting some calories in, and that can be through a variety of sources, and they can all be liquid bases. Jellies are great, ice cream is okay as long as they're fine with dairy. Often sort of yogurts and yogurt sachets are really good. Icy poles from the supermarket are excellent. So no, it is not a great problem to have no food for a few days. Almost all children will tolerate that absolutely fine, as long as they're not just having water. If the child is just having water and nothing else and no solid food, then that would be something to seek a medical review, just because that child won't be getting any salts or calories or any sort of intake that way. What
about pain? Tummy pain. This is another reason often why parents come into perhaps the emergency department or are thinking about visiting the doctor, and it's not uncommon for them to actually think, oh, maybe it's something else. Perhaps this is appendicitis. The pain seems so bad, surely it's not gastro.
We have that a great deal. Parents come in mainly concerned about appendicitis because they've got vomiting and they've got tummy pain and they think that it's appendicitis. That is actually very unusual for an acute presentation of appendicitis. That would be very low down on my list of a child who came in with acute vomiting, so sudden onset vomiting. It's much more likely to be gastroenteritis. They get tummy pain. It's often quite a crampy tummy pain. It sort of comes and goes. It's very spasmodic. It's often quite hard to treat because it comes on so quickly and goes away so quickly. By the time you've got some medication, some paracetamol or ibuprofen for that child, often the pain has gone away. So things like distraction are really important. We find sort of using the iPhone or the iPad to distract the child when they're having that acute pain episode. What I quite like to advise families to do is have regular painkillers while the child is having the illness, and that would be paracetamol 4 times a day. It gives a good background level of pain relief and eases the child's discomfort. But specifically about more severe things, it's almost always not, but there's a couple of things to watch out for. Persistent pain in the same spot that doesn't go away and isn't spasmodic, often in the sort of lower right-hand side, that would raise a couple of flags that would be potentially more interesting for appendicitis. But that's very unusual in just an acute, sudden onset vomiting illness.
Okay, and when you say acute, you mean sudden onset.
Sudden onset,
comes
that's
out
right.
of nowhere
Yes.
and is reasonably severe
Yep.
and sudden, and then similarly might settle down and go away.
Yes, that's right.
Okay, that's really helpful advice for people. And then a little bit more now about the diarrhea. So diarrhea, it's not fun for anyone. When we are perhaps in an emergency department or as doctors and we hear that diarrhea is part of the story, to an extent that's a bit reassuring for us. Is that a fair comment?
I think that's absolutely true because what you don't want is just a sudden onset vomiting illness with no other abdominal pain and no diarrhea. That might raise your flag to something else. But again, that's almost always gastro as well, but it's just something to watch. With the diarrhea, yes, it can be terrible, and you're changing your nappy or your undies all of the time. Children have accidents, which is really horrible for them and for family members. But again, it's incredibly unlikely to get truly dehydrated from just diarrhea alone. So plenty of fluids in. It might feel as though you're putting fluids in and they're coming straight back out again, but in that time through the guts and the digestive system, they will absorb some of that fluid, and that will help them stay hydrated.
Great. And then some advice about the spread. So one of the things about gastro is we know it's pretty contagious. And so by that we mean it can jump from one person to the next in the household and even outside of the household, obviously school, kindergarten, childcare or work. What's the advice there?
So it's hand hygiene. So they need to wash their hands, both you as parent and your child or your young person. Very, very good hand hygiene. If you can try and keep them a little bit separate from other family members, that's great. That's often not easy to do at all. But perhaps keep them away from very, very young children or elderly relatives, because that can be a little bit more significant for that group. But it really is just really good hand washing for everyone in the family, anyone who comes in contact with that child. Otherwise, it will go through all of the family members very quickly.
And what about hand sanitizer versus hand washing?
Yeah, great. I'm happy with either. Hand sanitizer is lovely and easy. I don't want to bring back bad memories of COVID, but lots of people have them around. Kids are quite used to having it, and it's a really quick and easy thing to do.
Another thing that people wonder about is how long do they actually need to stay at home, perhaps away from childcare, kindergarten, school, and then for parents themselves away from work and other activities. What's the advice there?
So the advice about returning to kinder or school would be 24 to 48 hours after your last episode of diarrhea. That can be really difficult for families. Families have possibly had the unwell child for 7 days with diarrhea and then another couple of days after that, and that's potentially 2 weeks off school or 2 weeks off kinder. But it's really important for the spread of the disease in the community because, as we've talked about, it's incredibly contagious, so it could whip around kinder and school, and those other children may have younger siblings or have vulnerable people at home, so we want to try and protect them as well. Another common thing we're asked about is the swimming pool. The advice is 2 weeks after symptoms have ended before you can go swimming. The reason for that is the pool is used by many, many people, and often those people might be potentially vulnerable to an illness, and so we want to really minimise the potential for that spread. So it's 2 weeks for swimming.
Yeah, and I guess one last question before we finish up. Can you catch it again?
Yes, absolutely. Unfortunately, you can have it a number of times, and coming into winter, we often tell some of our families you can be having 8 to 10 viruses a year, especially in the younger age groups. And so having back-to-back viruses over winter is not unusual. So we have a lot of questions around that. And it's just because we're inside together, we're passing them all around together because we're not outdoors. But having back-to-back viral infections or back-to-back gastro is not particularly unusual, unfortunately.
Thanks so much, Tom. There's no doubt that gastro is a bit grim and something that unfortunately we as parents are going to encounter. So really good advice there to help people avoid it, avoid the spread if they can at home and elsewhere, but also what to do if you do find that gastro has hit your household and how to manage that at home and when to seek help. There's more advice, of course, on our Kids Health Info fact sheet for parents at home. But thanks so much for joining us for the chat today.
Thanks very much for having me.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.